everyone, this is Teach Med channel and I'm Sarah. In today's video, we will continue discussing opioid, but this time we will discuss opioid dependence, opioid toxicity, and opioid addiction. Sometimes people get confused between using these terms, but I'll make it simple for you. So let's get started. First, opioid dependence, and from its name, it means that the person depends on opioid. His body cannot leave it, and if you stop it, he will start to develop withdrawal symptoms. So let's read. Physical dependence is defined as a characteristic withdrawal or abstinence syndrome when a drug is stopped or antagonist is administered. Like this guy in the picture. He cannot leave opioid. But what's the withdrawal symptoms? Remember the cold turkey. Can you describe it? Yes. For me, he looks anxious. He's craving for opioid. Where is my opioid? And he's sweating, having fever, chills, and tremors. Oh, can you see his eyes? It's red because he can't sleep. And pupils are dilated. Mydriasis. If you can recall from the previous video, we said opioid causes meiosis. So if you stop it, you will see the opposite. He has tachycardia and hypertension and later may develop nausea, vomiting, muscle spasm, or seizure. Next is opioid toxicity. Toxicity means that this person has taken a huge amount of opioid at once that becomes toxic in his blood. And if you want to know this person is having opioid toxicity, look for opioid triad. Pinpoint pupils, which means meiosis, respiratory depression, and unconsciousness. You have to immediately support the patient, ABC, which means airway, breathing, circulation, support his respiratory system, and maintain his blood pressure. You may read or hear gastric lavage, but really, we don't do it anymore. Give him antidote, which is naloxone. If you remember, naloxone is an opioid antagonist. And to prevent relapses, we can give him naloxone once he is detoxified. Lastly, opioid addiction, which means that this person has been taking the opioid for a long period of time, compulsively, even though he knows it's harming him. So let's read. It's a psychic and a physical state characterized by compulsive behavior to obtain the drug and experience its psychic effects, despite full knowledge of its harm. I'll make it easy for you. Remember the 5 C's. Chronic use, compulsive use, control is impaired, craving the medication, and he is continuing taking the medication despite harmful effect. If he decided to stop opioid, we can let him into a detoxification program with methadone. Do you remember methadone? Surely you do, but let's revise it together. This is a potent mu receptor agonist taken orally, and it has a long half-life, which makes it a good option, and it has a good bioavailability. And here's the summary from TeachMed for today's video.